Hi, YouTube. It's Kyle Kittleson here with MedCircle. We're 15,000 people away to 1 million subscribers. Incredible. What a milestone for us, for the community, for MedCircle. Thank you so much for supporting this credentialed mental health education. Now, today, I wouldn't consider this necessarily mental health education. I'm not a doctor. I'm not a therapist. I just interview them on TV. But every Monday, I go live here on YouTube to talk about something related to wellness or mental health. And last week, I talked about bullet journaling as one of the core strategies I use to maintain, my overall mood and well-being. We got a lot of positive feedback on this. My gosh. So in this video this week, I'm going to actually show you how I bullet journal, what bullet journaling even is, and some of the ways you can utilize this process to perhaps, I don't even want to say improve your life, but just add this activity to your life to give you those moments of reflection and mindfulness. I think it's really important here that we don't position this as a way to improve your life. Maybe your life doesn't need improvement. We don't have to come from a place of lacking. You're probably good right now, but this might be a tool that could make things even better. And I guess that is a form of improvement, but I just want to make sure that people don't use this or that we don't say, that you need to change your life. You need to improve it. I don't know. Maybe you do, maybe you don't. Who knows? Only you know that. I will answer comments towards the end of this video. And if you're watching this on replay, we will have chapters set up so you can scroll through to get exactly what you need. But first, let's start with what bullet journaling is and what we're going to talk about today. Bullet journaling is a form of habit tracking, mood tracking, expense tracking, planning and organizing your appointments, actual journaling and writing, but it's all done in a bullet journal. Here is a branded bullet journal. There it is, bullet journal. We will link to an affiliate link in the description below this video. And inside, the pages are not lined. They simply have these dots all over them. And the dots allow you to create your own pages or templates. If you go Google bullet journal templates, bullet journal pages, you'll find lots of inspiring design ideas. I'm not an artistic person. I wish I was. I'm a very minimalist person. So once we explore my bullet journal today, you'll see that the aesthetic I chose is very minimal and easy. Okay. There are some people who spend hours creating beautiful pages with lots of colors and images and color keys and all these things. I don't do that. Minimal, simple. To me, this is something that takes 5 to 10 minutes at the beginning of the week and all of 60 seconds once a day during the week. So in a week time, I'm probably spending, 17 minutes on this. But I feel like I get a lot out of it. So that's number one. I do not bullet journal for my appointments for anything other than I track behaviors and I track my sleep. So it's habit tracking and tracking sleep. This is different though than goal setting and goal tracking. And I think this is very important. I'm not sitting here and making a list of saying, I have got to work out 3 times this week. And then I check it off when I do it. I have a spreadsheet that you'll see here in a little bit, and I check off how many times I work out. So this is not to make sure I hit certain milestones. This isn't to make sure I get enough sleep. This isn't to make sure I take my meds every morning. This is, hey, did you take your meds this morning? How much sleep are you getting? How consistent are you being with any number of habits? And we'll talk about habits in a little bit. So that's very important as well. I think it is a great supplement to your goals. And it's a great way to look back and see, all right, am I doing the things that I would need to do in order to achieve something? But I don't use this as a goal setter. This is a habit tracker. This is supposed to tell me the truth, the realness. If I only went to the gym once this week, it will be reflected in this journal. I also think it's important, and I can hear Dr. Ramani in my ear already. And I don't know if she would agree to this. Maybe she'll watch this and tell me. But I can hear Dr. Romney, one of our clinical psychologists at MedCircle, going, I think that's great if bullet journaling is helpful to you and you want to do it. But look out for, or don't make it where it consumes you, where this becomes your Bible as opposed to something that helps you. I know there are a lot of people, if one little issue if they don't draw a line perfectly in their bullet journal, everything falls apart. If they miss one day of habit tracking, everything falls apart. Y'all, this is supposed to be easy. No one's making you do this. When I first started bullet journaling, I could feel myself drawing my first page and I made a mistake. The line looked bad. And I thought, oh my gosh, I'm going to have to start over. And I go, no, you don't have to. This page is just going to look a little different than the other pages. No big deal. We're not going for perfection here. Remember that. Now let's talk about some of the habits that we can track. Actually, it might be better if we just show you what a design setup looks like, and then I'll talk through it. So Bridget, when you're ready, throw up that clip. And today is Monday, November 1st. And I did this morning, and I filmed it and sent it to Bridget, who is live on this call. And so this is how I start each week in my bullet journal. Now, typically I'll do this on Sunday nights so that on Monday it's ready to go. But Sunday was Halloween and I was trick-or-treating with my nephew, and I didn't feel like coming home after that and doing this. So I did it this morning. So you'll see it's very, very simple. I know someone's going to ask, the pen I'm using is a Uniball Vision micro pen. And I don't have the size, but I'll find it and put it in the description. So the first thing I do is track all of the list all of the habits that I want to track during the week. Now it looks like it's stalling on my end. I don't know if it is on your end. This should be much clearer and easier. Maybe it's my internet, but you'll see that I have made I can't even see what I'm writing anymore. So I'm just going off. Bridget, can you send me a text and let me know if people can see this or not? So you can see that in the left-hand column, I've written down some of the habits that I want to track. And then on to the right, I've listed the days: Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and Sunday. I've put in my Prozac that I want to take, whether I worked out, and whether or not I've taken some vitamin D. Yeah, it looks like, guys, that it's not coming through very much. I'm sorry about that. We're using new software, so this will have to get addressed in future videos. Bummer, but there's lots of great bullet journaling templates you can watch on YouTube that are not of me, and actually something you can see, because this is clearly not good. Don't take it down, Bridget. Let's see is there anything we can do to fix it other than taking it down? Yeah, maybe that looks a little better. I don't know. But also, guys, you get the idea, right? This isn't rocket science. This isn't rocket science. You just make a graph, okay? Now, on the second graph, I'm tracking my sleep. That gets a separate spreadsheet, so to speak. You can see on the third column from the left, I screwed up what was supposed to be a moon, so I just scratched it out. One error I made in this actual graph is that I started the week on Monday. It should start on Sunday, because I track on Sunday night what time I go to bed and what time I wake up Monday morning. And then I track how many hours I slept on Sunday night. But we have a graph. And then the graph is at the bottom of the page, and it just tracks how many hours of sleep you get each night. So at the beginning of each day, you can see from the graph in the middle of the book how many hours you slept. You point that on the graph, and then you'll see throughout the week where in the week you're getting more or less sleep. Now, tracking all of these habits and tracking your sleep by itself may or may not do anything for you. I like it because it just gives me a little time to reflect each morning on what I need to do and what I've done in the day prior and that day. But what is really useful is seeing where there is some correlation to your mood or your attitude. Not to bring up Dr. Romney again, but Dr. Romney has shared on MedCircle that she, I forget the system she calls it, but essentially she gives every day a plus, a minus, or a zero. Plus days are good, minuses are bad, 0 days are, not good or bad, just a normal day. And if she sees that she's getting a lot of minuses, and I might be screwing this up a little bit, maybe she uses numbers or something, but it's more or less the same idea. But if she's seeing a lot of minuses, she's going, okay, I need to do something here. I'm working too much. I've got too many things in my environment that is causing me this type of unnecessary stress. So I need to make some adjustments. What I like to see is how my mood is compared to my sleep. On the days I get more sleep, how is my mood? I also might want to see, why is it that every Wednesday I seem to wake up earlier, or why is it every Friday I seem to go to bed later, or whatever that reason is. And it might be something that you're not even aware of. That's the real kicker here, and the real value is that you might be waking up groggy every Tuesday morning and you don't know why, and you might not even realize it because Tuesday could be, it just runs in through your life. You don't recognize that it's every Tuesday. You just go, sometimes I wake up tired. Well, it might be every Tuesday you wake up tired, and it's because every Monday you, I don't know, go to an ice cream social and eat ice cream, and you have a lot of sugar and you don't sleep well, so you wake up early on Tuesday. I don't know. I'm making things up. But you want to look for those correlations or trends to see if there's something within your environment, something that you can control that might be able to improve your life. For example, I thought if somebody had asked me, how much do you sleep on an average night? I would say probably 10 hours is my average. However, when I look at it, there are days I'm only sleeping 7 or 8 hours. And I thought, I didn't know I only slept that much. I thought I was sleeping 10 hours a night no matter what. Not the case. So, and that's important for me because I have Crohn's disease and I have to look at my sleep as a way to treat Crohn's. And so if I think I'm getting 10, but I'm only getting 7, and then I go tell my doctor, yeah, I'm sleeping great. I sleep 10 hours a night, and I'm not, I'm giving my doctor wrong information. And that, of course, affects my treatment. Another benefit is medication management. Getting myself included, to take their medication consistently is difficult. I don't have the rates in front of me, but people who consistently take their meds as prescribed, it's. I remember being surprised that it wasn't a higher number. There are so many of us who can't do it. We forget. We don't like the way it makes us feel. Something else comes up, whatever. This really illustrates, when you start tracking this, how consistent you really are being with your care, your self-care, which includes the medicine you take, which includes self-care behaviors. If you start tracking this and you say, all right, I got to take my medication every day, and I want to go on a few walks every week, and I want to make sure I meditate a few times a week, and I want to make sure that I'm drinking enough water, or whatever the things are that you want to track that are good for you, you're going to see real quick how much of that you're actually doing. And it could surprise you either way. You might be thinking, I don't drink enough water. There's no way. And then you start tracking the water you drink and you go, oh my gosh, I'm drinking plenty of water. But what I'm not doing is having any solo time. I don't have that. And I don't have that because I've been tracking my behaviors and my habits over the last 3 weeks, and I don't see it. And so this is an opportunity for you to see where there are areas in your life that you could add some reinforcing habits or behaviors to, and where in your life you might be, struggling a little bit. Most people track their habits. They track their good ones. They go, I'm going to track how much water I drink, how many times I go for a run, blah, blah, blah. I also track my bad habits. I track every day that I have a drink of alcohol. So, and I don't drink a lot, but I want to see how much I am drinking. So in my habit tracker, I will have my medications, I work out, the supplements I want to take, and then I will put no alcohol. And every day I don't have alcohol, I check that box. Now, it is not designed for me to not have alcohol. This isn't saying, all right, Kyle, do not have alcohol. And every day you do it, you get a check mark. It is, did you have alcohol today? Yes or no? You can have as much as you want. Go for it. Just track it here and let us know if you did. Let us know. Let me know. The journal know. If I did have alcohol. And you'll start to see very quickly that you may or may not be participating in those less desirable behaviors more or less than you think. It's really, again, not a way to set goals, not even a way to improve your life necessarily. It is to get a snapshot of the reality of your life. At least this is how I'm utilizing the habit tracking in a bullet journal. Now, one question is, it gets, what type of things should I track? Well, my first piece of advice on when you decide what to track is to not track a lot. One big mistake people make early on is they get excited and they go, well, I'm going to track everything. What time I wake up, what time I go to bed, what I'm eating, what I'm drinking, who I'm spending time with, how much time I spend at work, how much time I'm doing self-care, what supplements I'm taking, how much time am I spending reading, doing yoga, meditating, partying with my friend. I mean, it just goes on. You can't track it all. You'll go nuts. Okay. Don't do that. Pick a small amount of habits that you would be curious to know about. If there was a genie in front of you and he said, ask me whatever, if you can figure out whatever habit you're doing in your life on a consistent basis, and I'll tell you what that habit is. What would you want to know? Would you want to know if you were getting enough water? Would you want to know how often you were exercising? Would you want to know how often you call your parents? Whatever it is, what do you want to know? Track those and don't make it a long list. 2, the criteria for tracking should be very simple. For example, one of the items on my list is no caffeine. I rarely ever get to check the box that says no caffeine, by the way. So today I thought I was going to do it. Woke up, didn't have any caffeine. I thought, oh, maybe today's a no caffeine day. Good for me. I buckled. I had a little canned coffee thing that I had right before this. And so that means I had caffeine. That to me is the criteria. Did I take any caffeine? If I took a little bit, if I have a sip of green tea for my criteria, that means I had caffeine. So I can't check off that I did not have caffeine on my list. The criteria should be really simple. If I have 1 glass of wine at dinner, that means I had alcohol that day. It doesn't mean I get to put no alcohol because it was just 1 glass of wine and I had a lot of water and blah, blah. No, make it easy for you to track yes or no. There are some things that aren't that easy. For example, how many glasses of water did you drink in a day? If you're trying to hit your 8-ounce glasses of water, I don't know if that's correct, but that's what I've heard. 8-ounce glasses of water. You would want to set up a separate tracker for that on your page. You don't have to have everything in one spreadsheet, so to speak. I don't track my water because I tried tracking my water and it's too much work, y'all. That's what I mean. It's just, I'm going to drink water and be like, remember I drank this water? No, I'm not going to do that. So keep it simple with what you want to track. And then before we go to some questions here, it's really important to, if you're going to explore bullet journaling as a way to help yourself, that you go into it not trying to make this perfect. If you're inspired by anything that we've talked about in this video and you go Google or YouTube bullet journaling, you're going to be blown away by people's pages. They are works of art. I mean, they're gorgeous, beautiful. It makes you want to go make one of your own. And if you can do it, great. But what happened for me is I got the journal and I got my ruler and I got my pens with different, the special pins for all this and blah, blah. And then I'm making my page and I'm screwing up left and right. And I'm like, gosh, this looks so bad. I mean, my first bullet journaling page that first week, it looked like a 3rd grader just went to town in this notebook. It looked terrible. This is not about, at least for me in the beginning, about making it look good. This is about, can I consistently track my habits and my behaviors? And to do that, I want to focus on just the tracking part rather than focusing on how does it all look? How beautiful is it? Is this Instagrammable? I'm not doing this for Instagram. I'm doing this for me. Now, if you're someone who wants to do this for Instagram and you're artistic and you want to turn this thing into a work of art, go for it. How fun for you. That's just not going to be my journey to go on. Now, I will show you this is what it would look like all completed, the outline at least. So you can see this week I have Prozac, workout, vitamin D, because I have pre-arthritis in my hips. How fun is that? And I'll check. So I took my Prozac this morning. So this is typically what I would do the next day. And so in the little box, I just put a little dot. Whoop. just like that. Easy. And then here's where I'll track what time I wake up, what time I go to bed, and then I'll put how many hours I sleep. And then those hours will be tracked in this chart from 5 to 13 hours, Monday through Sunday. So let me put a sheet up of a completed week. And let's see. Here's a good one. I've only been doing this for 6 weeks too. And I will tell you the real benefit for me is, sorry, I'm putting this over here because there are some things that, people don't need to see. The real beauty is I never write anything down on paper anymore. Everything is digital. Everything in MedCircle is run digitally. All my communication is digitally, like most people. So it's nice to get back to pen and paper every single day, even if it is just for less than 60 seconds. So on October 11th, you can see we have a completed week here. All right. So for whatever reason, I didn't take my Prozac on Saturday or Sunday. That other med, Propecia, I didn't take at all that week because my prescription ran out. I actually just got it in today. And I only worked out on Wednesday. That's the truth. So the absence of dots means it didn't happen. You can see no caffeine. On Friday, I had no caffeine. Every other day, I had caffeine. And then we can look at my sleep down here, and you can see the hours and the tracking down there. Now, I have this Oura ring now, except this isn't an actual Oura ring. This is what you wear to, they send you a sizing kit. And this will track sleep, so I'll probably stop tracking sleep in here once I get my actual Oura ring. But I might supplement it with some different types of habits or behaviors to track. I really enjoy it. It's a relatively inexpensive investment. You don't have to use the brand name bullet journal. You can use any journal that has dots in it. You don't have to have fancy pens. You can use any pen you want. You don't need a ruler even, because there's plenty of dots. You just draw the line, follow the dots. It's very simple. And there's no wrong way to do this. Some people live their whole lives through a bullet journal. Other people like me only use it for, very specific things. But if you are somebody who likes to plan, likes the feeling of being organized, and can see the satisfaction of tracking your behaviors and habits each day and looking, and when I say looking, it's not like we're researching this. It's quick. You just look. Is there any correlation? I know Monday was a really great day for me. Why is that? Well, hey, I worked out. I didn't drink caffeine. I didn't drink any alcohol. I took all my meds and I got 10 hours of sleep the night before. No wonder Monday was a good day, So you can start to see those correlations. And if you do go to a doctor or a therapist and they go, "How's your sleep?" Well, you can go, "Let me tell you how my sleep is." You got it all right here, ready to go. It is something that I really enjoy doing. I wouldn't be presenting it if I didn't enjoy doing it. I'm on week 6. We'll see how long this goes. Maybe I quit next week. I have no idea. Maybe I'll do it for the rest of my life. We will see. I am going to now check in to see if there are any questions from the live YouTube audience. Let's see here. There is an app. Yes. So there are lots of habit tracking apps. I tried 2 or 3 of them, did not like them. I think it's because I don't like being on my phone. And so then I'm going to start each day or end each day by getting on my phone. That just does not sound like a good way to start or end my day. So I did, the app thing wasn't for me, but hey, if it's for you, go for it. Somebody said this seems like a lot of work. I would say it depends on what your definition is of a lot of work. There is a learning curve for sure. That's why I really encourage you to watch some actual bullet journalers on YouTube to get inspired with how you want to leverage your own bullet journal. People saying I'm angry about caffeine. Okay, let's see. Thanks, Kyle. This was extremely helpful. Well, that's nice. It's better to do it by physical writing. The simple act of using a pencil is therapeutic. I agree. I like it. And this is something I don't travel as much as I used to, as most people, but I still have done a little traveling as of late, and I've brought this with me. And when this moves more into the goal area than in the habit tracking area, but what it does is when you have this and you're traveling, there's a part of my brain that goes, oh, I better make sure I do that. I better remember to do that because I'm going to track it later. And when I'm traveling, that's usually when my brain goes offline. My brain goes, oh, who cares how much water you drink or if you exercise or what time you go to bed? Like, you're traveling, everything, you can do whatever you want. And this keeps me more in line, or at least I can see if I'm more in line or not. Okay, I'm going to stop there. I really apologize for that video. It was hopefully going to really illustrate what it's like to actually sketch out a page. But again, there's no shortage of those out on the internet and on YouTube. I appreciate you all being here live. Hopefully this was helpful to somebody. We'll be back next Monday with either more mental health and wellness insight and tips, what's working for me or other members of the MedCircle team, updates on MedCircle, or what we have on the docket for MedCircle. This week in MedCircle, we have new videos coming out, of course, on our YouTube channel. We have new blog posts coming out on our website, and we have new emails going out to everyone on our email list. So if you are not a MedCircle member and would like to become one, you can go to medcircle.com and start there for free. Thanks for being here. And remember, whatever you're going through, you got this.